All right, my friends, welcome back. And let me take another Diet Coke sip. You're like, Miss Sage, you could have done this before. I know, my guys, I know. But I am preparing for the reason I was so obsessed with psychology, let alone was abnormal, but schizophrenia. I researched it for like at least 6 months straight during high school because I was so obsessed. Because I was like, what? I find the abnormal so interesting, and schizophrenia is up there for me. It's probably one of the top things I've researched the most. So schizophrenia, let's start with psychosis. So schizophrenia is it's now on a spectrum to encompass the many and varying degrees of symptoms a person can have and still be identified as a schizophrenic. Schizophrenia is actually broken down into more categories over the years than it actually used to be. So first, what psychosis is a symptom, not an illness. Psychosis is a symptom, not an illness, in which thought and emotion are so impaired that they lost contact with reality. So, for example, someone who has been overly abusing Adderall, who hasn't slept for days, will slowly slide into a type of psychosis that is where they lost touch of reality, but it's due to the lack of sleep. Right? Because remember, our brain tends to go insane if we don't sleep. So psychosis is a symptom, not an illness. Okay, symptom, not an illness. So let's talk about what schizophrenia is according to the DSM-5 criteria. And there is some criteria, so we really want to go through these, write down all the information. Super important to know. The AP test loves talking about schizophrenia. So in order to be diagnosed as schizophrenic, you have to have two or more of the following, each present for a significant portion of time during a 1 month period. So they're going to study you for 1 month, okay? And what they're looking for is these four things. Delusions, and this is also a vocab word, is when people have irrational and false beliefs. I am God. The government is watching. That's a paranoia. It tends to fall under that aspect. You're under the delusion that someone's out to get you, right? So delusions are false and irrational beliefs. Accompanied with delusions, hallucinations. Hallucinations are false perceptions of things that are not there. So one of the big characteristics of schizophrenia, especially in the media, is them talking to people that are not there. It is a hallucination. It is all within the brain, my friends. Schizophrenia, so on this slide, it is genetic. It is a genetic abnormality within the brain. It is passed down through the mother's side. Okay? On top of delusions and hallucinations, you also may encounter disorganized speech, which we'll explain on the next slide too. And then also grossly disorganized or catatonic behavior. So you're either all over the place where you can't stay still or focus on a conversation, or they're known to show catatonic behavior of being still and rigid. Okay? An exception to these two symptoms requirement is that only you don't have to have both delusions and hallucinations to be categorized as schizophrenic. You only require one of them. So if your delusions are bizarre, or if your hallucinations consist of either a voice that keeps on running on commentary in your thoughts, or voices that converse with each other. So a lot of people who start to develop schizophrenia, and we'll talk, and again, there's just so much to talk about, but I'll talk about it on the next slide. But an exception again is that for the two symptom requirement is that it's okay if you only have delusions or hallucinations, but usually a schizophrenic brain has both. So a couple of facts about schizophrenia, and I'm sorry that somehow that page is a little cut off. It's a type of psychosis where individuals again lose touch with reality. About 1 in 100 people worldwide have this disorder. Okay? It can develop at any age, but it usually emerges during late teens and early 20s. That is when our brains are starting to fully develop, and that is when schizophrenia is usually triggered. You are born with a schizophrenic mind, but it has to take time to develop. Remember, schizophrenia is genetic. There is a chemical imbalance that is happening within the brain of a schizophrenic, okay? Very often, the onset of these symptoms correlate with excessive and extreme stress that could either trigger it, and it can be debilitating without treatment. When we talk about treatment next week, or not next week, our next part of our Unit 8 unit, there are some of these mental health disorders that therapy is perfectly fine. We don't need to take medication. Schizophrenia is by hands down 100% in my belief, you need medication in order to live a semi-normal life. Without treatment for schizophrenia, it's really hard to live a normal life. And I don't want to say normal life, but it's hard to live a life in general with you constantly hearing and seeing things. And a lot of the homeless population, they are going undiagnosed with a lot of these mental health disorders. Okay. And I couldn't imagine not having an antipsychotic medication with a brain that is doing that to itself, right? So that's kind of where we talk about, the therapy versus medication. And schizophrenia is definitely needs medication to help regulate. So there's something called positive and negative symptoms to schizophrenia. So when you think of positive symptoms, I want you to think of it as something being added to their behavior. So a positive symptom would be distortion or excess of normal functions and tend to be most frequented in the first stages of early episodes of schizophrenics. So in the presence of inappropriate behavior, these things are added. So some positive symptoms, a delusion is a positive symptom, is where delusions are being added into the equation. Hallucinations is a positive symptom of schizophrenia. Disordered speech, often resulting in people not making sense to others, but they may be making sense. It's essentially them talking in their own lingo to themselves, but you don't quite understand where they're going, which is disordered speech. And disorganized behavior. Okay, these are positive symptoms that are being added to inappropriate behavior. Now we also have negative symptoms. So negative symptoms are behavioral deficits or a loss of decrease of this function, and a lot of this is due to when they start taking medication. Okay, it creates these negative symptoms. So a negative symptom includes the flat effect, avoiding eye contact, and have expressionless faces. So when I talk about bipolar and schizophrenia and when they have to take their antipsychotic medication, the medication kind of cuts their emotions in half because it's calming the chemical balances down. Okay? In schizophrenia, there is an excess amount of dopamine going through your neurotransmitter. Remember we talked about this? They have too much dopamine being flooded into their brain. Okay? The medication stops the dopamine, right? But it has side effects. So the flat effect is one. Apathy and non-interest, monotone voices is also a negative symptom of schizophrenia. Poverty of speech, so long lapses and slowed speech. So they might pause halfway through their talking and need some more time to think about what they're going to say. A slowed speech. So again, these are negative symptoms to schizophrenia. Usually they are due to taking an antipsychotic, okay, for helping medication. All right, let me make sure. Okay, we're going on to that. Okay. So, and then a lack of directness. So slow movements, just like we talked about, little interest in social participation. Okay, So there is something called chronic and acute schizophrenia. Chronic and acute schizophrenia. When schizophrenia is slow to develop, it is called chronic schizophrenia. And recovery, it's really hard. And when I say recovery, I don't mean recovery of like they no longer have it. I mean that they are able to live the best lives that they can with this disorder. Okay. So such schizophrenics usually display negative symptoms. So chronic, really, that means that it's slow to develop, but also it hits kind of the hardest. And then when schizophrenia rapidly develops, so where it's like kind of an acute reaction, so it's like a quick and reactive reaction with schizophrenia, they've seen correlations where recovery is somewhat more easily there. But usually, again, acute versus chronic, when we say recovery, we're trying to have them live as normal lives as possible. Okay, because you can't cure a schizophrenic brain. You can help mediate, right, with the medications, and where you can go live a great life. But the medical health, the biomedicine, right, is the antipsychotics are needed. So common characteristics, kind of going through it, is in addition to common positive or negative symptoms described, also some really big kind of symptoms that we see is paranoia, which is preoccupation with delusions and hallucinations, often with themes of, persecution, grandiosity. So like essentially, people are after you, right? So paranoia is very common with schizophrenics. And then there's the catatonic, which is when we are immobile or excessive purposeless movement. So extremely negative, parrot-like repeating of speech and moments. It's almost just like you're not even there, right? So you're catatonic. And again, these are all common characteristics of people who are dealing with schizophrenia. So a little bit of understanding schizophrenia. It is a disease of the brain that is exhibited in symptoms of the mind. So again, it is genetic. The brain abnormalities is in a dopamine overactivity. There is too much dopamine flowing through your brain. The AP test will ask you, what neurotransmitter has excess with schizophrenia? It is dopamine. We need to know that dopamine connects to schizophrenia. So higher levels of dopamine, D4 receptors in the brain, is the correlation to schizophrenia. Okay, that's what leads to the hallucinations. People who take LSD might have similar experiences to the life of someone who is a schizophrenic for a short amount of time, where you hear and see things. But again, it is a chemical imbalance within the brain. And just, some brain anatomy and schizophrenia. So usually people who have schizophrenic brains have abnormally low activity in the frontal lobes. Hallucinations, usually there is too much activity in the thalamus, our sensory switchboard. So when they go through all these scans of the brain, this is what they find. The greater the shrinkage of the hippocampus and the amygdala, the worse the disorder. So within a schizophrenic brain, they tend to have a very small, they have a smaller hippocampus and amygdala. Okay? If the thalamus is small, the greater difficulty is in filtering information and possibly reacting in the correct manner. So these are all genetic abnormalities that we find in a fully developed schizophrenic brain. When we go over our brainstorm next time, there is a couple of childhood cases of schizophrenia, and they are rare. For the most part, schizophrenia develops when people reach puberty. Puberty is what essentially triggers schizophrenia. Okay. Genetic factors. The likelihood of individuals suffering from schizophrenia is 50% if their identical twin has the disease. Fun fact. Early warning signs of schizophrenia include a mother who has schizophrenia, because it gets passed down, birth complications, if you're deprived of oxygen too long, along with low birth weight, short attention span and poor muscle coordination, disruptive and withdrawn behavior, emotional unpredictability. Because remember, our amygdala is smaller, which creates our whole limbic system to kind of go out of whack. And then poor peer relationships, and usually they play by themselves. We will talk more kind of about schizophrenia and a little bit more into our brainstorm, but just know that, again, genetically, this is how your brain is born. Okay, so again, there's not really, so again, genetic passes through the mother. There can be, I'll talk about fugue states later, but that's essentially what it is. Okay, I'm gonna stop talking. That's all I got for schizophrenia.